we've had 4 local health and care systems from all around the country, from Fylde Coast to Frimley to Somerset and to Stockport, who have come together as a group to design and come up with some ideas that will help patient care within all of their local healthcare systems. And we're here today to hear about the work that they've done over the past 100 days to help improve patient care, and also to hear about some of their recommendations for national policy and to some of our national directors in NHS England regarding some of the work that we could take forward to share across the rest of the country.
Being part of this programme has been really quite an eye-opener for me. I think the most important thing that's come out of it is really looking at the whole patient experience, right from prevention through pathways through to patient experience in secondary care. And what's really helped with us is that we have managed to form a really close-knit team, really across so many sectors involved in the care of patients with musculoskeletal disease. I come from secondary care, but we've really worked closely with primary care, social care as well, and third sector. And to work with these has been a real privilege and an eye-opener, and has just shown that we need to get out of our silos so we can produce the best management for patients.
We had a shared problem that we all wanted to solve, and the biggest thing I found was we were treated as adults, so actually we were allowed to have ideas and think about them and try them, and if it didn't work, it didn't work, rather than being with good support from management around us, but it was a team-led approach. We weren't dictated to about what to do, so it meant we could actually have new ideas without as many constraints, although there are targets we worked within.
The thing that made the biggest difference was engagement with our GP colleagues. As time has progressed in my consultant career, I've found that interaction with GPs has become more and more difficult because everybody's so busy, and it's mainly limited to fairly short letters. To be able to have a telephone consultation or a conversation has led to a much more meaningful dialogue about patients. It's allowed us to advise our referrers in a much more timely fashion.
So we're already seeing changes that are really positive for patients, and the work we've been doing in diabetes, where we've now got clinics happening in primary care, identifying and changing treatment plans for some of the most high-risk patients, but also spreading the learning within the practice and enabling the learning that's taken with those joint clinics between GPs and the primary care team and the acute care team, the specialist team, spreading that learning back into the practice for a whole load of other patients. So I think we're in Somerset there's a real desire to take this as a methodology and to spread it out and use it as the way that we make rapid change in the county.
Multidisciplinary patient education session for osteoarthritis of the knee that's included from surgical talks to management of osteoarthritis, what is osteoarthritis, myth busting, even getting patients to discuss their own experience in a community setting, with lots of stands around the room for people to engage with weight management, exercise in the community, and being able to understand more about the osteoarthritis of the knee. In these sessions we've had great feedback. By day 100 we'd had over 100 people had been through 3 workshops.
So the bit that I've really enjoyed about being part of this programme is actually being able to let go and entrust some of the local clinical experts in each of the 4 areas that we've worked with to come up with ideas that they think will make a real difference to patients in the communities that they work in, but being able to make sure that that is translated into national policy for the rest of the country to follow.